call again on Saturday morning in the Department of Health to formally launch the National Framework for the Management of Endometriosis in Ireland. And I really do want to thank those of you who came this morning and acknowledge that many people were invited for whom it wasn't possible for them to come, didn't suit them, they weren't well enough, they weren't able. The invitation was put out there as broadly as possible, and so glad to see so many people here today. And I want to acknowledge all of those. This is not a finite group. We know that this is a community that goes very far beyond that. I really do want to acknowledge what Bernard has said there in relation to the experience that I hope that we have tried to create and foster since the beginning of September here, and to see some measure of responsiveness to that now this morning, some 6 weeks later, I suppose. And most important in that is acknowledging and thanking the voices of the women who spoke on that day in the patient forum, women living with endometriosis who courageously, very openly shared their experience with us here in this room, as well as all of the very many advocates that have spoken so loudly and not necessarily been heard, all of the advocates who went before that day for a very long period, of different ages, in different ways, in different forums, and who were not necessarily heard here, were not necessarily heard in maternity hospitals, were not necessarily heard in so many different settings. And I want to acknowledge their contribution and all of that work that has gone before that. All of that contributes to what we are trying to do and how we are trying to respond now. The patient forum was very, very important, but it did also spectacularly delay the launch of the framework for a very good reason, which is that having spent the time and tried to listen on the day, we did then literally change many parts of the framework in terms of language, in terms of trying to reflect lived experience. And so I think in my heart that the language of the framework has evolved directly as a consequence of what we were privileged to have the opportunity to hear in that patient forum. But I'm very pleased and delighted to be in a position to publish it today. And I really do want to thank all of the people in the last number of weeks as well as all of the patient voices. There has been, as Bernard says, a spectacular amount of work done. We here in the department, in NWIP, Cliona and Killian in the HSE, all of this, the team here, both on the maternity side and the national and women's health more broadly, and the patient forum, patient support groups more broadly, and in particular in my own office, Amelia Francis, who has done a huge amount of work, really at top speed, to try to present a developed policy framework with multiple different aspects that is responsive to what we know is missing in the system, notwithstanding that many women are getting treatment that they're happy and comfortable with. We are very aware that there are so many as well who are not getting that, and to try to reflect their experience and develop a programme that will start to be more responsive to their need. So I do want to really recognise the body of work that has happened in here, because I know you can't necessarily see it, but trust me, it's been quite different, and it's been really, as Bernard says, at speed, and we really have put our heart and soul in it, recognising that it's not the end of the programme, but it is a really important beginning. I also want to acknowledge the very many people, the clinicians, and the College of General Practitioners, who have also really seriously contributed to that body of work, and it's great to see them here today. We know, and we want to state loudly, that endometriosis is one of the most common women's health conditions, one of the most common women's health problems in Ireland today, with no known cure necessarily. And it really has, as Killian and Kilina and Bernard have said, it has been under-recognised for too long, both within the clinical community and within society more broadly, and employers and families. It has been under-recognised for far too long. And now we want to really turn the tide on that, to raise awareness, to expand and enhance our services, to support doctors, surgeons, medical teams in upskilling in the way that they would like to and need to deliver the best for you, their patients here in Ireland. So the framework, for the first time in Ireland, we now have a framework setting out a defined clinical care pathway for women and girls with endometriosis in Ireland. So that is something, that is important. And central to the model of care, and I cannot state this loudly enough, central to the model of care is the principle of presumed diagnosis. Presumed diagnosis. Acknowledging loudly that women are always the most reliable narrators of their own experience, the most reliable narrators of their own symptoms, the most reliable narrators of their own pain. They are not my words, they are the words of the very excellent Amy Brown, one of your strongest advocates, where she said that to me, women are the most reliable narrators of their own experience, and she is so right. And so I asked her if I could use her phrase, and she very kindly said yes. So let me say it loudly: women are the most reliable narrators of their own experience, and that is the model of care in the National Framework for Endometriosis. I know that every single woman, every women with very complex endometriosis has at some point not felt heard and not felt believed, and it is an important frame. So the framework is a very important tool in raising awareness and acknowledging acknowledging that, and trying in the clinical community to reduce, as clinicians want to do, to try to get a solution as quickly as possible, to reduce the time it has taken to get a diagnosis, which we know has been far too long for so many women. Last month I was in this room with senior officials and clinicians to meet and to listen, and I'm very, very glad that we had that opportunity, and it really has informed this framework. But the framework is one thing, actions and getting on with things are another thing, and it is important, as Bernard has said, to turn the words into actions. And just so that you're aware, so my role is to set policy and to make sure the funding is there for the policy. It really is now for the HSE at an operational level to get on and deliver that with NWIP, and that is an important body of work now. But the policy direction, let me be very clear, is a couple of different things. I wrote to many of you at the patient forum about the number of steps being taken over the next period. So let me just set out and reiterate some of those. We have an additional 100 surgeries to be carried out this quarter, i.e. between now and the end of Christmas, at the end of the year, across the different regions, focusing on the more complex or the longer waiting patients. And that is an important and significant addition to the number of surgeries that would otherwise have occurred. And that additional surgical work has begun on the 1st of October, and I will get my first update in about 2 weeks with details about which region, which surgeon, and crucially the types of surgeries as well, so that I can begin to understand and track that over time as well. And I highlight the type of surgery because so many of you have come to me sharing your frustrations with different types of surgeries and with the effectiveness or not of different types of surgeries. And I have to be clear that it isn't my place as Minister for Health to enter into debate, a clinical debate as such, about the nature of surgery or excision versus ablation as such. But I am a public representative and I am your voice in many ways. And so it is very important that I articulate your voice to say that there is a dissatisfaction and a conversation to be had, I suppose is the best way of saying, about the nature of different surgeries. I have heard what you are saying to me, but I am not a clinician, and it would be dangerous for me to step over that line. An additional colorectal surgeon has already been advertised for recruitment to support more complex surgical treatments, and I am being kept up to date on how that recruitment process is going. The HSE has carried out a thorough analysis of the short-term and longer-term requirements to build what I believe to be adequate capacity to improve clinical pathways in the way that I would like to see, and to increase expertise within our services in the way I think is necessary. As you're aware, the department, we've just gone through a budgetary process. The overall health budget now, we have had an uplift of 6%, 6.2%, which is really important. And the way that that works now is I work out with the HSE how we determine that amount of money throughout the different regions. We're trying to achieve regional equity so that your experience in Donegal is equivalent to the experience in Dublin, and we really are not there yet, and that is a complicated process for us to go through. But in general terms, let me say this: while we have invested in endometriosis to date, and we have recruited about 50 people into this service in phase 1, shall we say, I do expect the need to recruit between 60 and 70 more people into this space over the next potentially 18 months. And there is despite that will be allocated around the different regions, but that is a very significant investment into a clinical area, into an area of diagnosis. So while we deal in broad numbers on budget day in terms of an overall 3,300 people into the health service additional, I'm just trying to give you some more detailed specifics in relation to how we see that in endometriosis. So that's additional staff, some who will be working in expanding endometriosis services. Bernard has spoken to this, and in particular, let me just acknowledge Bernard's work and the HSE's work, and it is their work to support women who need treatment abroad and who need surgical treatment abroad and who have needed surgical treatment abroad. This is a really important piece of work, and we'd like to try to explain that a little bit further. It really is through the HSE, but it is to try to recognise that there is a cost to it and a process to it, and the work that we're trying to do is to make that simpler, easier, and I'll perhaps leave Bernard to explain the details of that, because it is properly for the HSE and not for me to step across. There's also been an endometriosis priority actions advisory group, again, which I asked to be established. It has now been established, thank you to the Women's Health Task Force for their work. That group will have their first meeting before the end of the month. There are four women with endometriosis on the group, as well as members of the Department of Health from Maternity and Gynecology Unit, Women's Health Unit, the Mental Health Unit, NWIP, the Irish College of General Practitioners, and the National Women's Council. And I want to pay a special thanks at this point to Tara Logan Buckley, who supported all of us at the forum last month. She has also been, I'm delighted to say, she's agreed to be part of that advisory group, and I think she brings something very special, as she did on that day. And it's an advisory group who I think will essentially provide expert advice, oversight, personal input and reflections and guidance around the priority actions. Tara is very sorry not to be here today, she asked me to say that, but she did specifically ask me to put a call out to some of the younger women here and to some of the younger women in the communities to partake in an awareness campaign that Tara is working on as part of her job with Spun Out about endometriosis and the impact on mental health. Spun Out, of course, is a sort of a younger person's organisation, and Tara is working with them, but she asked me to put that out, and we'll get more details from Tara on that, but perhaps you might link in with me if there's an interest in that, but it really is Tara's body of work. Finally, for now, we are inviting international endometriosis experts to collaborate, to engage with our clinicians, to improve endometriosis treatment options, to build expertise, to share learnings. I was told about one surgeon who, from a hospital in Ireland, who was planning to travel with one of her patients to not supervise, but to observe a surgery that patient was getting elsewhere. And I just thought, wow, that's absolutely fantastic. Like, we have a phenomenal clinical community in Ireland. Endometriosis hasn't been well enough understood. But what I've seen from clinicians is, yeah, let's do more. Let's do better. Let's go. Let's be fantastic. And what Cliona said, I think, is really important. Ireland is one of the few states in Europe. While there's good treatment elsewhere in Europe, we have a framework and we have a desire and a drive to be able to give the best surgical solutions to the women of Ireland. That is where we want to get to, and we all in this room recognise, including the clinical community, who have been trying to support so many women, and I know who want to do more to support women, and I'm really, really encouraged and thankful to them for their role in that way. But how are we going to do some of that? Our endometriosis clinical specialists now are going to participate with international accreditation, I can't say that word, accreditation recognition through the British Society for Gynecology Endoscopy. A range of engagements and opportunities, including a focus on endometriosis at the Royal College of Physicians of Ireland annual conference in March, are being pursued. In conjunction with the publication of this framework, Bernard and I have written to every GP across the country, informing them of the framework launch, informing them of the framework, trying to drive awareness of such a common condition for those GPs who are not perhaps as aware as we might hope, many are. A similar letter will be issued to the clinical community in the coming days. The HSE has also planned a GP practice update and an endometriosis awareness campaign to follow on from the publication of the framework, maintain the focus and the work of raising awareness. Through this national framework for endometriosis, together with the commitment of our clinicians, our advocates, our policymakers, and most importantly, women affected by this chronic condition, I really do believe that we can, as Bernard has said, take steps towards transforming the model of care that has been there for women, particularly with complex and severe endometriosis. I do recognise, and I have met so many women who are being cared for in a way that is working for them, and I want to acknowledge and recognise that absolutely. But I really also acknowledge that there are many women who have not gotten the level of treatment that they have needed, that they have suffered as a consequence. We do not want that to be the standard in Ireland. We need to together lift our standards, lift our expectations, and you will never hear from myself or Bernard Gloucester that we feel that we are there yet. We come to this with complete humility, with complete dedication to try to improve the services, to want to try to make sure that people's experiences are lifted and better overall, and that we do not have young women suffering in pain when they're supposed to be going to school, when they're supposed to be playing sports, when they're supposed to be living their lives. That is not the situation that I want for women in Ireland, for girls in Ireland, and I really do believe that with this level of commitment, it will take us some time, but we will improve this, and we will make this better for the girls and women yet to come. I'm so glad that we have managed to get this piece of work done quickly, and really I see this as the launch and start of a different model of care and a different, I hope, attitude to women, a different attitude to listening to women, and I hope a humility that comes with this different way of looking at endometriosis, presumed diagnosis, with the woman's voice at the centre, recognising always that women are the most reliable narrators of their own experience, their own symptoms, and their own pain. Thank you so